Let's get to our big story. Gun violence in Oregon and across the country is in the spotlight yet again after recent mass shootings. As Christine Pedawanich found out, there are people who have dedicated themselves to understanding the problem and hopefully finding solutions.
I spoke with an injury prevention researcher at OHSU, and part of what she and her team looks at is gun violence and ways to reduce it across Oregon. Here at OHSU and the Veterans Affairs Medical Center in Portland, researchers are studying gun violence through the lens of public health.
We're looking at all gun injuries treated in emergency departments and urgent care centers across the state. And we're also looking at firearm-related deaths across the state, and we're evaluating those for patterns. I'm a professor of public health at the OHSU and PSU School of Public Health.
Dr. Kathleen Carlson and her team got funding for gun violence research from the CDC a couple years ago after Congress appropriated $25 million for it.
That was a new CDC source of funding that went out to several states around the country, ours included.
It's a big deal, especially, she says, since funding for gun violence research was restricted for many years.
The NRA viewed this as a way to publicly fund research that supported gun control. And so they worked with Congress to change the budget appropriation to the CDC. If funding goes to gun violence research, then the CDC will lose its entire budget for injury and violence prevention. So this totally stopped gun research.
But now she says things are starting to change. So what has her team learned so far? Oregon averages over 500 gun deaths each year. About 80% of them are suicides, and there are also a lot of unintentional injuries.
And what we've seen in our VA data, we've seen that any treatment for a firearm injury that was non-fatal is strongly associated with a subsequent death from a firearm, most commonly suicide.
Carlson says they're thinking of ways to intervene at the hospital level when people come in, but they're also looking at possible changes at the community level to reduce gun violence. One idea, using environmental design.
On the national level, what we've seen evaluated robustly is the use of greening initiatives, which is taking vacant lots, greening those vacant lots, reducing urban blight or vacant buildings.
After so much gun violence in our communities, Carlson says it's not inevitable. We can do something about it, and it starts with understanding the problem.
But it's not hopeless. There are myriad ways to evaluate this and get a handle on it.
She likened it to advancements to car and road safety over the years. The same can be true with guns and gun violence, balancing safety and freedoms.
Gun injury and gun violence is not inevitable. There are solutions, there are patterns that we can evaluate, and that means that there are solutions and ways to prevent it.
And Dr. Carlson says we need to get rid of the idea that it's a gun rights versus gun control issue because, in fact, there's a lot of room in the middle, and if we can just get there, we'll have a better chance at finding a viable solution. Christine Pedawanich, KGW News.
And if you or someone you know is in crisis, the Suicide Prevention Hotline is available 24 hours a day. The number is there on your screen. It's 1-800-273-8255.